Hello, good morning, everyone. This is Dr. Eric Bricker, and thank you for coming to the Friday training session for A Healthcare Z. Today's topic is the Healthcare Entrepreneur Playbook. Now, as always, if you could please do a quick audio video check and make sure that you can see and hear me okay. If you can put in the comments either on LinkedIn or YouTube, if you can see and hear me okay, that would be great. Um, it would also be wonderful if you could put in the comments where you're viewing from today. I always like to see where the viewers are coming in from, because a lot of times we not only have people from all over America, we have international viewers as well. And so it'd be great to see where you are all coming from. And as you're putting those comments in, I will jump to the quick introduction of who I am. Many of you know who I am, but for those of you who don't, I'm Dr. Eric Bricker, the founder of A Healthcare Z, and I actually was originally a hospital finance consultant, and then went on to medical school at the University of Illinois, and then residency in internal medicine at Johns Hopkins in Baltimore, and worked as a hospitalist physician at the Baylor Plano Hospital here in the Dallas, Texas area. And I actually started a healthcare navigation firm called Compass Professional Health Services. So it's my entrepreneurial experience starting Compass from scratch, a bootstrapped company that we grew to tens of millions in revenue. And we had over 300 employees. We had 2,000 employer clients. We had close to 2 million members that we supported across the country. And we sold that business in 2018 to Alight Solutions. And I then started making healthcare finance educational videos. That is A Healthcare Z, which many of you watch. Thank you so much for watching them. And I'm also now the medical director for Simple Pay Health, which is also a digital health entrepreneurial organization or startup, if you will. And I was actually the chief medical officer of a telemedicine company called First Stop Health as well. So I sort of had three entrepreneurial experiences, with Compass being the biggest. So we got Georgia and Florida, Kansas City, which could be the Missouri side. I love both sides of Kansas City. I actually worked in Kansas City for almost a year back in the late 90s. We have international viewers from India. Awesome. Here. Oh, Singapore, right here in Dallas, Texas, local to me. Fantastic. Toronto, Canada. We love our friends north of the border. Wisconsin, Nashville, Philadelphia, Portland, Maine, Kalamazoo, Michigan, Utah. Wonderful. Hey, thank you all so much for being here from all these wonderful Houston, Arizona, Croatia. I think this is the first time we've had somebody from Croatia. Welcome. Stockholm, Sweden. Excellent. New Jersey. I, of course, love the Garden State. It's the state that I was born in. A lot of my family's from New Jersey. Gotta love Dubai. Wonderful. Hey, it is fantastic to see all of you. Thank you so much for tuning in from all over the place. So now, when we talk about the Healthcare Entrepreneur Playbook, obviously, in order to start any healthcare organization, you have to have founders. So you obviously have to get this right. So essentially, this is like the most important slide of everything that we're going to talk about today is the initial founders. Now, and of course, as I go through this, please put your questions and comments in the comment section as well, and I will answer those comments as we go along. And if I'm not able to answer those comments during the talk, then I'll answer them in writing afterwards. So please put your questions and comments in. Okay, so the founders. Okay, so I would argue that if you're going to be a healthcare entrepreneur, that you have to have a team, that you cannot be a solo healthcare entrepreneur. You really, because if you're because obviously if you're going to be an entrepreneur, you have to have a company that has customers. And in order to convince people to be your customers, you at least have to prove that you can convince other people to actually start a company with you. We at Compass had 3 co-founders. That was very helpful, because that way, if we ever had a disagreement and we had to vote on it, we had an odd number of people, so that obviously it would always be either 3, 0, or 2 versus 1. And we all collectively agreed that if you were the one person who was dissenting, that you would go along with the vote. Okay, so having an odd number is helpful. Those three founders, the skill set required to start a healthcare company essentially never exists in one person, right? So, a lot of entrepreneurs, myself included, we tend to be rather prideful and we think that we can do everything. And of course, we cannot. We do not have skill in all areas. And so you really need to find complementary people who are not like you and have very different skills and experience from you. So oftentimes, the person, one of the founders is a technical person in that they have expertise, oftentimes in software, which is super helpful. You have to be able to have a sales person to be able to get customers, where that's like their sole focus is to get customers, because without customers, you have no business. And then it's very helpful to have, obviously, the business needs to make money. It needs to have an economic machine so it is financially sustainable. So to have somebody with a finance background is helpful as well. Now, we were fortunate at Compass in that our CEO was that finance person, but he also had our CEO, Scott Shamevogel. He was fantastic. We were unbelievably fortunate to be able to find each other, to be able to do this. He was also a fantastic doer and had tremendous execution skills. And when I say doer and execution skills, what that really means is problem solving and initiative. And so I would argue all three of us had to have that quality, but Scott had it in spades. So those are, now we had two of the three founders with healthcare knowledge. And I would say that because healthcare is so unique and idiosyncratic, it's very important to have people who understand healthcare in some respect. That to a certain extent, healthcare entrepreneurship, this is my opinion, I could be wrong, it's very hard for someone to do right out of college, right? So you have all these like, other, software startups, they're started by 22-year-olds in their garage or whatever, and you can totally do that. But it's very hard for a 22 to know healthcare experience to then start a healthcare company, because healthcare is so easy to have sort of a baseline understanding of those idiosyncrasies in order to be able to effectively create a company that addresses some of those idiosyncrasies. And then when you, if you can actually have some sort of history of working together as three founders, then that's super important, because you have to be able to trust each other. And you have to understand that you're going to go through hard times together, and you're going to be willing to work through those hard times. The three of us had especially in the beginning. In the beginning, you're going to face existential problems like on a weekly basis. Like we had things that could, essentially destroy the business that happened like at almost weekly. It was probably monthly. And we would get into serious arguments about how to solve those problems. And at the end of the day, we had to be able to like essentially forgive each other. I mean, we would get really mad at each other, and we would have to forgive each other and put our differences aside, fist bump, and move on. And that was hard to do. Okay. At least for me. It was probably easier for them, but it was hard for me. Okay. Next, okay, when in the very beginning for your initial plan and like your initial like slide deck, obviously you need to have a name for the company. You need to have some sort of legal document. Oftentimes it's referred to as an operating agreement that outlines like the ownership structure of the company. Now we had equal. It was a third, a third, a third. So we had equal ownership amongst the three, and that, in my opinion, was super helpful, because you kind of want everybody equal. So everybody being equal was very important. You obviously have to every state requires you to get a business license. We're fortunate in the state of Texas; it's super easy to get a business license. I imagine in other states it's easy as well. And then you have to set up a banking account, a bank for your company as well. And the legal too, you obviously have to set it up as an LLC or a C corp or an S corp. And there are and you also immediately want to go out and look for domains as you're thinking about your company name. You want to look for the domains as part of the process so that you can get a website that's either your name or close to your name. So having a domain that was available was key in creating the name of our company. So our domain, we could get compassphs.com so that we could have our name be Compass Professional Health Services. Okay. Now, you do not create a detailed business plan. Instead, you create a rough outline slide deck, and you can also use something called the business model canvas. If you just Google business model canvas, it will help you think through the different parts of your business. And you're like, okay, I have to start a business. That business has different things. It has sales, it has marketing, it has supply chain, blah, blah, blah. It's got pricing. And so therefore that business model canvas allows you to address the sort of big buckets within your business. Okay. And then you create all that, and then you immediately go out and you start a process of what is called customer development. And one of the best people about customer development is this guy named Steve Blank. And he wrote this book called The 4 Steps to the Epiphany. So I would argue, if you're going to be a healthcare entrepreneur, that reading Steve Blank's 4 Steps to the Epiphany should be required reading. Now, you then go out and you have 50 conversations with who would be your customers, because essentially your startup is just a hypothesis and you need to constantly test that hypothesis. And so these initial 50 conversations, they can be phone, they can be Zoom, they can be taking people out to lunch, is getting feedback from the marketplace. Because one of the common things around starting a successful company is that whatever your ideas are about how you should do something, again, it's just a hypothesis, and there is a very high probability that your hypothesis is going to be wrong. And you, as an individual, guess what? You are not right. The market is right. Now, if you think the same thing as the market, great, you're right. But the source of truth is the market, okay? The source of truth is the customers. It is not yourself. So you have a hypothesis about what you think the market was. You have a hypothesis about how you think customers want to buy, but you need to literally talk to them to gather that information. Okay. Now, you're also, while you're doing this, you're going to start a rough website, and you're going to start creating content. You're going to start blogging. You're going to start posting on LinkedIn and Twitter. And that's because for SEO purposes, one of the main important things for the Google crawlers out there is just how long your website has been in existence, and that your website is actually creating new content and new pages. So there's more pages for it to crawl. And so you want to just not just create, and you can use, there's all sorts of ways. You don't need to know how to code. You don't need to hire a coder. I mean, you just, you use GoDaddy to get to register the domain name. And then I use MailChimp as actually like the hosting platform for my A Healthcare Z website. And it's just literally, it's like drag and drop. I mean, you don't have to know how to code at all to be able to create a website, and then you link your domain name to it. And there's other sources besides MailChimp out. I have no connection with MailChimp. There's other sources besides MailChimp that you can use for just drag and drop website creation. So it's super easy to do. And then how you then structure your website, and you do LinkedIn posts and your blogs and your Twitter. The website on Startups is a fantastic resource for that. And then on Startups is maintained by one of the co-founders of HubSpot. His name is Dharmesh Shah. And then HubSpot also has a ton of resources for starting your digital presence as a company. Now, this is bullet number 5 is the most important bullet on this slide, which is you're doing all this before you raise any money, and you're going to keep your day job. Okay, so the very first step in starting a company is not quitting your job. Okay, you need to have a job and you need to keep it. Okay, so you're going to keep your job. Okay. Next, the issue of raising money versus bootstrapping. Okay, so if you want to raise money from venture capital firms, you need to have a scalable business, because venture capital only invests in companies that can become very big. And so very big by definition means it's scalable. What scales? Software scales. Healthcare is tricky because healthcare is largely a services business. And so you might start, there was a local occupational therapy practice that has grown. They specialize in occupational therapy for kids with autism, and that is a services business. That type of healthcare business, you can't raise venture capital for that business. You're using your own personal money, and maybe you're going out and getting a loan from a bank that you have to have collateral in order to get that loan. Okay, but if it's just a services business, you cannot use venture capital as a mechanism for raising money, because they will not invest in you. It has to have some sort of scalable aspect to it, like software, or it's a product, or it's biotech, or it's a med device. Okay, this next point here is my opinion, but at Compass, we tried to raise money in 2007 and 2008 during the great financial crisis, and we talked to gobs of venture capitalists. We had gobs of presentations. We failed in raising any venture capital, but it was a huge learning experience. And we also, over time, over the years, we also had various conversations with other venture capital companies and private equity firms. So we had gobs of conversations and meetings and due diligence and all sort of stuff with that. Now, venture capital, in my opinion, really is a club. And if you're not in that club, you're not going to raise money. Now, independent of your idea, independent of you and your skill and your willpower, like, you don't matter. Your idea doesn't matter. Are you in the club? In order to be in the club, it typically is a function of what school you went to. And it's really like, did you go to an Ivy League school? Did you go to MIT? Or did you go to Stanford? Like, the vast majority of people who are able to raise venture capital went to those handful of schools. Okay. Or do you know people in venture capital through a previous job? Maybe you were at another startup that used a venture capital firm and you have connections through that. Okay. So because you have a job that got you connected in with venture capital, or maybe you just worked in venture capital yourself. So a lot of people who do digital health startups, they used to work in a venture capital firm, so they know a lot of people. Okay. Or you have friends or family, like they were your roommate in college, or it's your uncle, okay, or your aunt, okay. Or a lot of healthcare venture capitalists, serial entrepreneurs, and they've already started a company and they were successful in running that company. And so just know that if you are brand new to being an entrepreneur, that you're competing with a bunch of entrepreneurs who are starting their second and their third businesses. So they already have a track record of success. The other thing too is just geographically, these people live in 3 places. They live in the San Francisco Bay Area, Silicon Valley. They live in the New York City area, and they live in Boston. Okay, so we were not in that club. The vast majority of all of you watching are not in that club. The vast majority of you did not go to an Ivy League school or MIT or Stanford. You don't have friends or family. You're not in San Francisco, New York, or Boston. Listen, you're like me, okay? And so you're not going to raise venture capital. So don't waste your time and don't try. You can try if you want. The reason I would say not even to try is because it is a waste of time, because it is a super low probability that it will happen. So just now, that does not stop you from starting the business. And that the alternative is it's called bootstrapping. Let me give you an example of sort of the prototypical person that's able to raise venture capital. There's this company called Rightway, which is a healthcare navigation firm that didn't really compete with us because they started kind of after we had already sold the business. Okay, they raised 2 million. Their CEO raised 2 million in seed funding, 8 million in Series A from Tiger Global, which frankly is one of the most well-known funds in the world. They raised 20 million Series B, and they raised 100 million Series C at like a valuation of like over $1 billion. They only had a handful of customers when they raised their seed round in Series A and Series B. I don't even know if they had any customers. Okay, their CEO went to Harvard. He then worked at Goldman Sachs. He then worked in private equity. Okay, so he was the prototypical person for being in the club. I would argue that there are gobs of digital health ideas that fail that are started by people who are already in the club, and they were able to get funded because they were in the club. Okay. So I'm not saying anything bad about that. What I'm saying is the vast majority of people are not in that club, and therefore to you have to start the business on your own. Okay, which is okay. It's very doable. I think it is the best way to do it because you preserve your ownership in the company. You don't get diluted. You don't have to sell your shares and your percent ownership to a venture capital firm. You maintain ownership of the company, which is great. You want to preserve equity. So bootstrapping allows you to do that. So now let me tell you how to bootstrap. You have to work 2 jobs. You have your day job where you're working 40 hours a week, and then you have your startup where you're working 40 hours a week. Now, in order to work 40 hours a week on your startup, one way to do it is you work 2 hours in the morning before your day job. You work 2 hours after your day job. So that's 4 hours per work day, 5 days a week. So that gets you 20 hours. And then you work 10 hours on Saturday, and then you work 10 hours on Sunday. So that is how you are able to work a second job while you are bootstrapping. Okay. You're going to keep your day job for probably at least 2 years because the number one enemy of the healthcare startup is time. It is incredibly slow in the beginning. So just know it is a slog, and it takes an incredibly long amount of time to gain any traction. Okay, healthcare is the exact opposite of Instagram, where the founders of Instagram started the company and sold it for $1 billion, like within 6 months. Okay, so direct to consumer internet stuff is super rapid. Healthcare is the exact opposite of that, which is fine, but you just need to plan for that. Okay. You need to create a prototype product or service because you don't have any money. I mean, you're literally funding this with your own savings and with like what you're getting paid from your job. So at Compass, the 3 of us put in like, I think we put in $8,000 each. Okay. So we put in $24,000 and like, and then we had like some money that we were making from our own jobs. All right. Now, like, okay, but I want to start a business where the product or the service is like this grandiose idea. The point is that your product or service needs to fit within the amount of money that you have. So you need to scale down your ambitions. I mean, if you want to create this awesome, like, let's say you want to create a new EMR, okay? You can't create a new EMR. You need to have a different ambition. So you need to have an ambition for what your initial product or service is that fits within the money that you have. Okay. So, and that's okay. I mean, it can over time evolve into your grandiose idea, but for now, it's got to be super small. Okay. Now, you need to give that product away for free. You are not going to charge anything for it because you need customers to actually start using it. And nobody is going to pay. Well, I shouldn't say nobody. Very few people. It's just a demand curve, right? There's a downward sloping demand curve. Go this way for you. okay, right? Where if the price is low, you can get more people to use it. So if the price is zero, you're going to get the max number of people to use it. And then as you, I gotta do the mirror image of my finger here. Okay, whereas if you increase the price if you have any price, by definition, you're going to decrease the number of people who use it. And you're going to have a very hard time in the beginning just getting anybody to just use it. So you want to make the price zero. So you need to give it away. And you're doing this because you're not only gaining feedback and experience, because you're going to alter the product based upon how people use it, but you're going to then create references, because you're going to just create such an amazing product or service that people are willing to be references for you. And then you're going to start the clock for how long you've been in business and have had customers. So that when you actually go out to paying customers and they say, how long have you been doing this for? You can say, we've been doing this for 2 years. If you go out and try to get paying customers and they say, how long have you been doing this? And you say a month, then it is going to be next to impossible to get any paying customers. So now, how do you create a 10x value proposition? All right. So in business school, they kind of teach people the 4 P's: the product, the price, the place, and the permission. Part of the business model canvas is you're going to solve for these 4 P's. Okay. Now, so right now we're talking about the product. Now, the product has to be 10 times better than whatever their existing solution is now. It can't just be a little better, because in order for them to go with your solution, it is a tremendous risk, because you're new, you're unknown, you're unheard of. So your product has to be really good. Okay, some examples of 10x value propositions were telemedicine and Teladoc. I mean, they were the first people to do it. And Teladoc's stock, yeah, it went through the roof and now it's come crashing back down. But at the end of the day, Teladoc is doing about $2 billion a year in revenue. I mean, that is a serious business. And being able to have a doctor visit from the convenience of your home, wherever you want, whenever you want, and actually be able to get a prescription that you can then get filled. I mean, that is a 10x value proposition that didn't exist before. Okay. Likewise, there was actually within a local Dallas brokerage that was a metabolic syndrome reversal program. It was originally called Naturally Slim. It then changed its name to Wonder, but it was a 10x value proposition for reversing metabolic syndrome through behavior change. I mean, it was a huge winner. Next, NaviHealth was a 10x value proposition for readmission reduction. Okay. We at Compass were a 10x value proposition for CDHP enablement. You could put in a CDHP with Compass, and it was 10 times better than putting in a CDHP without Compass, because you had this awesome support service tool to help your employees with this new dynamic of a high deductible with an HSA card. So that was our 10x value proposition. And we lucked out in that it was during the time when CDHPs were growing, and employers and broker consultants were like, okay, if I want to put in a CDHP, I need to put it in with Compass, because that is a 10x value proposition versus putting in a CDHP by itself. And so you're going to create this 10x value proposition by fixing one thing for one niche of customers. And you're going to solve that problem 10 times better than anybody else who's currently trying to solve that problem. So the point here is, anytime in healthcare you see something as a solution for quote unquote all stakeholders, or enabling all stakeholders to win, that is the opposite of what you want to do. You want to pick one stakeholder, one sub-segment within that stakeholder, and you want to really solve that problem for that one stakeholder, okay? And then the way you're going to do that is outlined in the book, Crossing the Chasm by Jeffrey Moore, okay? So I told you that you got to read the Steve Blank book, and then you also have to read the Jeffrey Moore book, Crossing the Chasm, because it'll tell you exactly how to do it. And we literally, I like flipped through the book. I probably read that book 10 times. I literally read through that book and I did exactly what that book told me to do. Okay, now, how are you going to get paying customers? You have to get the distribution right. You have to figure out how customers buy what you buy. So you're going to change what they buy, like the product, the value proposition is different, but do not change the way that they buy it. You need to approach them the way they buy other things. Now, for employers, it's largely through their broker consultant. For physicians, it might be through their practice manager, or they might have some other way. But you need to go through the existing way that they already buy stuff. Okay? Now, when you then figure out how they buy stuff, you need to do lead generation, which involves interrupting people. You're going to interrupt people because they're just, they're, you need, and this is where, my role at Compass as the salesperson was just, I just literally did this all day long. The founders need to do this. You cannot outsource this. You have to do this yourself. You have to have one person whose full-time job is literally to just interrupt people. And you interrupt people through phone calls. You literally call them. It's an exercise in leaving voicemails, but you literally call people. You do LinkedIn messages and you do LinkedIn posts and you email them and you go to conferences. And literally you just spend all day long, and your goal is to talk to people daily. You have to talk to people daily. If there's ever a day that goes by when you haven't talked to somebody, then that day, frankly, has been a failure. And you pick yourself up, brush yourself off, and you say, okay, I'm going to start again tomorrow. You have to talk to people outside of the building every day. This is I would argue, one of the main reasons why startups fail is they don't talk to people every day. And the CEO thinks that he or she can only talk to people every once in a while, and that's enough. No, you have to have one person who all day, every day is just talking to people. Okay. If you're bootstrapping, then you need to target small and medium-sized businesses or small and medium-sized physician practices. You are, as a bootstrap startup, you are not going to approach a carrier or a hospital. They will almost never work with you. Okay. So you are a super small fish. You need to be able to approach other super small fish as well. Okay. And you need this track record. Again, that 2 years of giving away the product for free is going to give you all these stats and all these use cases and all these case studies and all these references so that you can actually get those initial paying customers over the goal line. So here are my take-home points. For one, you have to have a team of co-founders. Two, just sketch out a business plan. It's just a sketch. And then you need to just take that business model canvas and that sketch and you talk to people. You are not going to raise money. You're going to keep your day job and you're just going to get started. You're going to solve one problem for one niche of customers really, really well. And then you're going to give it away for free. And then you're going to get market feedback, which will dramatically change everything. At Compass, we were originally going to be a personal health record company where we were going to collect people's health records and put them on a thumb drive for them to then take to whatever doctors they had so that their doctor could just put the thumb drive into their computer and see a unified medical record for them. Okay. That then became a healthcare navigation business. Okay. So I will tell you, whatever your original idea is, there is a very high likelihood that your ultimate successful business will be very different from the original business that you envisioned. And so with that, because we're a little bit over time here, I will answer your questions and comments in writing. So thank you for putting all your questions and comments in. Please connect with me on LinkedIn or follow me. If you would like a copy of these slides, or if you would like to subscribe to my A Healthcare Z video newsletter, then please email me at ericb@ahealthcarez.com. If you're on YouTube, you can also subscribe to my A Healthcare Z YouTube channel. All of you are super You are my partners in helping to make healthcare better for patients. Okay. Right now, we have patients that are suffering because of the way that the financial incentives in healthcare are structured. And all of you are my partners in helping to change that. And I am incredibly grateful for each one of you for doing that. And so, with that, have a great Friday and a great weekend. Bye now.